if she wants to go out dancing or to church or to dinner or what have you.
Let's go to Ralph Merkel, who was out at your facility where you have one of your patients who was demonstrating how you fit the device and how one of them works.
Hi Wayne, I'm here at Louisville Prosthetics downtown, and we're going to see a fitting of a new limb here. This is Wayne Luckett, and we're joined by our patient Tony. Give me an idea of your injury and how long you've waited for this limb.
My injury was I lost my foot to diabetes. I had an infection that would never clear up, and I had it amputated in May by Dr. Ramsey, and it's come along very, very swiftly, if you will. I thought that I would never walk again, but Wayne kept telling me that I would, so things has gone very well. I'm in my second, or actually I guess my final prosthetic, which is just August now, so that's pretty rapid.
Yeah. Explain what we're doing here.
Okay, what we're doing here today is a diagnostic test socket fitting. Anthony started out with a preparatory device with a manual locking system, which was used to hold the prosthesis in place. And his limb has atrophied and matured to the point where he's gotten to where he's wearing multiple socks to try to keep the device in place. So what we're doing today is a socket replacement, and we're going to introduce vacuum technology to hold the device in place. We're hoping to improve his comfort and his stability, and at the same time progress him even further from crutches to single cane ambulation or even unassisted ambulation. That's our goals with this device today. So what we're going to do is, the first thing we're going to do is just roll the liner in place. This is a cushion liner that we're going to use on him.
And that's actually going to, is there a vacuum he's going to have to push a button?
Yes,
or?
he's going to have an electronic vacuum system that's going to be attached to the front of the prosthesis, and we'll see that shortly. And he will actually manually flip the switch on, which will activate the vacuum, which will actually pull the prosthesis into the limb surface and keep it intact and in place. It reduces movement within the socket environment. It also helps to increase blood flow to his residual limb, and it helps with vascular flow as well, which is one of his issues.
And this top part of his prosthetic device there, that has been custom molded to the bottom of his leg.
Yes, it was. We saw Anthony a week ago, I think it was, where we took our initial impression of his limb. We put the liner in place over his limb and took measurements and took a cast impression, which was used to rectify a model and create this diagnostic socket today. Everything that we do here at Louisville Prosthetics is custom fabricated for the patients in order to help them regain their independence.
Okay.
Okay?
Great.
So we're going to roll the liner in place. You start right on the end.
And that rubber goes next to the leg because it won't slip at all, I guess.
That's correct.
Right?
This
Yeah.
creates it's actually a suction liner. So once this is rolled in place, there's no displacement or movement between the skin and the urethane material. So any displacement, if any does occur, is going to occur between the exterior of the liner and the prosthetic socket.
Okay.
Okay? So at this point, we're going to go into the socket. And you hear the air
I can hear that,
expelling
yeah.
out the back. And now I'm going to ask you to stand up for me. Give your crutch there. There's the second one. Hold on to that.
Kind of feels 100% better.
100% better, and we haven't even turned it on.
I turned it on.
Okay, so I just want you to kind of keep about half your weight down on there. We'll take a look at you. So the first thing I do is I look to make sure we have a total contact fit. We've got complete encapsulation of the residual limb inside the socket. We make sure there's no tightness anywhere. Make sure that the knee is fully engaged in the top of the socket.
Yeah, you wouldn't want that to interfere with his kneecap at all, right?
That's correct.
That would hurt.
That's correct, yes, absolutely. Look at the trim lines. Make sure his condyles of his femur coming down are clear. Everything looks good. And then the last thing I do before we introduce the vacuum to the system is I ask the patient, how's it feel?
Feels great.
Okay. So we'll just...
Were you able to walk well before, or had your foot really atrophied a lot through your disease?
I was able to walk before, but when the foot got infected, I couldn't walk on it then. That was the reason for the amputation.
Mm-hmm.
But the only thing I feel is like I felt before on the other one. I got that. Let me show it.
Yep.
It's this right here. Right there.
Okay.
Might need to be turned out a little bit.
Yep. So what he's feeling is there's a little bit of pressure on his lateral condyle here. So I'm going to take this plastic device,
Mm-hmm.
put some heat to it, flare that out just a little bit, and improve that comfort in that region before we finish this up. We had just a little too much bony contact right here. We heat this plastic with a blowtorch. Soften it up a little bit. And then we just move it with a towel. You can see how that flexes out
It cools real quickly.
rather quickly.
Is that special kind of plastic?
This is Vivac. It's a material that's used a lot in our industry. There are several plastics to choose from. We've had good success with it. And then we're ready to continue with the fitting.